Welcome everybody to this pre-interview for the Ifso Journal Club of March 10th, which is upcoming in a couple of weeks. I'm very happy that you took the time to watch this interview and get a little bit excited already for the true journal club that is here to come within minutes, days, or weeks. I'm very pleased to actually welcome the first author of an article that I think is very interesting for many of the listeners today, which is Guillermo Ponce de Leon, who actually published this article online already, and it will be on paper available as well in the upcoming weeks, together with Hugo Sanchez Aguilar, Maureen Musti, and of course Miguel Herrera, who needs no further introduction. The first and last author both work in the ABC Medical Center in Mexico City, in which Guillermo also got his, let's say, surgical training, becoming a bariatric surgeon, amongst other types of surgery. He also took his time to actually went to the Mohawk Medical Center in India to work together with Malfowi, and recently he got his master's degree in science. The article he published was named Roux-en-Y gastric bypass in patients with severe obesity, primary response criteria, and their relationship with comorbidity remission. Guillermo, let's start with just the first question to tease the people a little bit to come and look at the 10th of March. As you might know, before we invite people to come and give their interview, there are a couple of recent articles selected from obesity surgery, and the reviewers found your article the most interesting for this session. What do you think about the article itself? Why was it chosen, do you think? Why is it so special? Please elaborate.
First, I really want to thank you and the rest of the Ifso office, because we are not expecting this, and we are so honored and humble because this is an invitation. Well, I think this article is specific and it could be a very special article, because what we found before we started to create this idea, we found that many other authors have used many different criteria to define success. A sum of 13 to define success, and up to 30 or even more criteria to define non-primary response. So, what we found also is that many authors of many surgeons uses in an arbitrary way to define success bariatric surgery in patients with severe obesity and excess of weight loss above 50%, and many others uses a cutoff point of BMI, probably less than 40 or probably less than 35. However, there is no consensus to define this. As you may notice, all of these criteria are based just in the weight loss, but none of the authors or surgeons define this or trying to suggest that we usually use a metabolic effect. So looking different series, we also found that many patients, a sort of 50% of the patients with severe obesity or BMI above 50%, want to reach an excess of weight loss above 50%. So probably we are failing, or that's what we're trying to see. But this is not as we were thinking. I think that probably we are giving the proper treatment for those patients. So the objective of this study was to compare the different primary response criteria and their metabolic effect, with the idea of establishing the ideal criterion for this specific population based on the metabolic effect rather than the weight loss just.
Excellent. So you have a different way of looking at outcomes compared to what is already out there. So that is very, very interesting, of course, because in all those years, not much has changed in the way we look at outcomes, of course. So excellent point. What without giving away all details, what can the audience expect at 10th of March?
Well, we would like to emphasize the importance of looking to the metabolic effect rather than just looking at the weight loss. That's our main point. We know that many operations, many other procedures have been described to give the best treatment or the best weight loss for these patients. However, we firmly believe that the remission of the comorbidities and reduction of cardiovascular risk should be considered along with the weight loss the main outcomes. So we're trying to give this specific point. We found that as much of 70% of the patients will reach the main outcome, that we found that it's a next of weight loss above 50%, and that it is enough and desirable that these patients loses this amount of weight loss. As many as 3/4 of the patients will have remission of the comorbidities.
So I see your enthusiasm, Guillermo. So I'm almost hesitant to ask you any more questions because we don't want to give away the whole program already. So I would like to invite the whole audience to come and join us the 10th of March at 2 p.m. Central European time. And for you, Guillermo, because you're in Mexico City, go to bed early because you have to be there at 7 a.m. In Mexico, let's say. So it's an early start of the day. And Dr. or Professor Herrera will join you if I understood correctly. So any last famous words to enthusiase our audience?
No, see you there by March 10th.
March 10th. See you there. Thank you.